Hi everybody, welcome to tonight's webinar all about supporting children with chronic illness. What we're going to do is just wait another 30 seconds or so before we get started, give everybody a chance to join in and sign up and make sure that they're all ready to go. We are using a service called StreamYard, so you may know that you can't turn your cameras or your mics on. That means that if you do have a question or there's something you want to ask, if you could just comment it in the Q&A chat box, you should see the comment section on the side there. While you're waiting, it would actually be really nice to know where you are coming from, what part of Scotland, and also maybe what your job title is, just because we're nosy to see the sort of people that have signed up and come along today. We know that supporting education needs of children is a really broad topic, so I imagine there'll be quite a spread of different people that are joining us today. But yeah, thank you for taking the time out of your working week or your evening to come and talk with us about supporting children with chronic illness. We'll give it another 30 seconds or so, and then I'll introduce you to the rest of the group that will be speaking today. Looks like we've got 25 people already signed up, which is fab. Cool, let's get everybody else onto the stage. So joining me today is Lisa from Enquire, and then we've also got Ali and Amber from the Teapot Trust. So I will do my own introduction and then I will let themselves introduce themselves. So my name is Beth. I'm an Advice and Information Officer at Enquire, and my focus is outreach and participation. So participation, working with young people, and then outreach, doing sessions like this, supporting professionals, but also parents and carers and children and young people to understand their rights to support at school. And then my colleague Lisa is going to be doing some of the talk today as well. Lisa, do you want to introduce yourself?
Yeah, hi, I'm Lisa. I'm an Advice and Information Officer at Enquire as well. I work on the helpline, providing advice and information to parents, carers, young people and professionals. And I also work on updating the website and creating new pages.
Fab, thanks, Lisa. We are also very, very grateful to be joined by two members of the Teapot Trust. So Ali, would you like to introduce yourself and who the Teapot Trust are?
Hello, yes, so I'm Ali and I'm here with Teapot Trust. Teapot Trust is a charity that supports children and young people living with chronic illnesses, primarily through art therapy, and we work mostly in a hospital setting, as well as in schools and online and in the community. And at Teapot Trust, I coordinate those art therapy projects, and I am also a youth worker doing participation work and supporting children and young people with long-term health conditions. And I'm really glad to be here and speaking with you all tonight. And I'm joined by Amber from Teapot Trust too.
So I'm Amber and I'm part of the Teapot Trust Young Voices group, which is a group of young people with different long-term health conditions who all kind of come together to shape and share their experiences and feed into Teapot Trust work. And I'm also a master's student in inclusive education at Bath Spa, and I finish in 10 weeks. So education is kind of my thing.
Very exciting. Thank you, everybody. And good luck with your last 10 weeks as well, Amber. So the plan today is that we're going to talk all about supporting the education of children with long-term health conditions. Myself and Lisa are going to do the first bit about Enquire. We're going to provide what Enquire does, which is additional support for learning guidance. We're going to talk kind of broad strokes about what children's rights are to support at school, and the sort of ground level we think you need to know about what the law says and what the guidance says. And then we're going to pass over to Ali and Amber, who are going to get into some more specifics about, okay, well, that's what the legislation says, but how does that apply to young people with chronic illness? So yeah, myself and Lisa will start off, and Ali and Amber, we will see you later on. So I'm up first, and the first thing we thought we should talk to you about is a little bit about Enquire. Just in case you haven't heard of us before. Oh yeah, and I'll just let you know, so the session is going to be split into two parts today. So the first part is an hour-long webinar part. So this is the bit where myself, Lisa, Ali and Amber are going to be talking at you, telling you lots of hopefully very useful things. And this part of the session is going to be recorded. So you'll be able to find this session on the Enquire YouTube channel after the fact if you'd like to watch it back. Or if some of your colleagues maybe weren't able to make it today, they'll be able to find the recording there. After that, we're going to do a Q&A part of the session. That part's not going to be available as a recording, but it's just an opportunity for anybody that is part of the session today that wants to ask a question. You'll have the opportunity to do that at the end. What I would say is that if you can wait until later on in the presentation, because hopefully we'll have answered a lot of your questions through what we're telling you in the webinar itself. So we'll have a little break between the two things where you can submit your questions to us. But obviously, if you do think of something as we're going along, feel free to pop it in the chat. I can already see we've got a lot of interest in the chat. People are telling us where they're from and what kind of role they have. And it's really great to see such a spread of people from across Scotland, but also a spread of different roles as well. But yeah, we are Enquire, myself and Lisa anyway, and Enquire is the Scottish advice service for additional support for learning. We're funded by the Scottish Government, and our role is to provide advice and information about additional support for learning in Scotland to professionals, to parents and carers, and to children and young people. And as you can see there, our vision is that all children in Scotland are supported, included, and listened to throughout their education. We do that in a few different ways. The first, probably most obvious way, is through our websites. So we have enquire.org.uk. That is our website for adults. So there's a section for professionals. There's also a section for parents and carers. And then we have reach.scot, which is our website specifically for children and young people. It's actually a lot of the same information, but obviously just tailored to children and young people so that they can read that information for themselves or maybe with a trusted adult. Another way that you can get in touch with us is through our helpline. That's the number there. And we also have a web form if you'd rather submit like a written inquiry, and we have web chat as well. Our helpline team, Lisa is a part of, and the helpliners are there to discuss maybe a really specific situation. If you want to clarify something you're not sure of, if you've had a look at the website and you think, actually, I kind of know what you mean, but I'd really like to chat this through with somebody, that's what the helpline team is for. They're a really friendly bunch, and they're there for you if you do have a specific question about a young person that you are supporting. And the last thing to shout out about is our news and events. So that Linktree link there, which we'll share at the end as well, that goes to all of our social media. We are on Instagram, we're on Facebook, we've got a TikTok. If any of you are young enough to be on TikTok, we have one of those. And we also have a newsletter that we send out bi-monthly. That posts updates about legislation, things that are happening in Scotland, but also our upcoming events and any new pieces of work that are coming out, new blog posts on the website, maybe a new webpage that's been written, all that stuff. So if you'd like to keep up with what Enquire is doing, that's the best way to do it. We are also a part of an organisation called My Rights, My Say. My Rights, My Say is a partnership organisation made up of a few different groups that basically all work together to support children and young people with additional support needs. My Rights, My Say is focused predominantly on the 12 to 15 age group because of what the law says about children having capacity once they're between ages 12 and 15 before they then become an adult at 16. So yeah, if you're supporting a young person that fits within that age bracket and they would need some advice or some guidance about getting their say, having their say in decisions about their education, My Rights, My Say is the place to look, and we'd certainly encourage you to do that. I am now going to pass over to Lisa, and she's going to give you just a sort of overview of additional support and how that maybe relates to your role and to your job supporting children with chronic illness. Over to you, Lisa.
Great, thanks, Beth. So yeah, children's rights, it's something we're going to focus on throughout this webinar, but we're mostly going to be focusing on children's rights around support at school. So while we are focusing on that, it's important to acknowledge that children have a whole host of rights, and they are set out by a number of different pieces of legislation. So this includes the right to an education, to have their views heard, and rights under the newly incorporated UNCRC, which is the United Nations Convention on the Rights of the Child. So yeah, we're going to be focusing on additional support for learning, or ASL, today. But the laws around ASL only apply to children who are attending local authority schools or nurseries, or when the child's place at a different type of school is funded by their local authority. So if the child that you're working with or supporting goes to an independent school or is home educated, then the ASL legislation doesn't apply. But we've got specific pages on our website about independent schools and home education in the parent and carers section of our website. So I encourage you to check that out if that does relate to you or the child that you're working with. Okay, so the definition of ASL. So today we're focusing on additional support for learning. And additional support for learning legislation sets out how schools and nurseries must provide support for children who have what are called additional support needs. So a child has additional support needs where, for whatever reason, they can't benefit from school education without extra help. So that's a really broad definition. But basically, it can be anything that's impacting the child's ability to learn, whether that's something short-term or long-term. It can still be considered an additional support need. Okay, so on this slide, there's some examples of additional support needs. So like I said, the definition is needing support for whatever reason, and the examples here are just a selection, so it's by no means exhaustive. But hopefully you can see from the example on the slide that additional support needs can cover many things that might impact a child's ability to make the most of their time at school. It's also really important to note that this definition of additional support needs doesn't include needing a diagnosis. So of course, assessing children's needs and understanding more about their needs, a diagnosis can be a really important and valuable part of planning their support, both for the professionals and for the family and young person or child. But the children do not need a diagnosis to be entitled to support at school. It's also important to remember that the child might have multiple reasons why they need support, and these needs can cross over sometimes. So, for example, if a child has chronic illness, this might impact their attendance at school and a chance to build friendships, and that could possibly lead to social anxiety or experiencing bullying behaviour from their peers. Not always, but it might happen, and all of those needs must be addressed and supported. So yeah, in summary, additional support needs is a really broad term that covers anything that is having an impact on the child's education. So it's important to remember that children can have many different needs. They don't necessarily need to be diagnosed or diagnosable needs. And children's needs can intersect and interact with each other, and needs can and often do change over time. Okay, so the duty to provide additional support for learning actually falls with the local authority. So that's the education department within the local council that the school works under, or the nursery. And in practice, it's often the schools who do a lot of the planning and providing of support to children on behalf of the local authority. So the law says that local authorities must make adequate and efficient provision of support. And this includes identifying children's needs, planning their support, and keeping that support under review. So what can support look like? So additional support at school can mean a lot of different things. So we've given a few examples up here on the slide of what it might look like, although again, by no means is it an exhaustive list. And as we've said, support must be based on a child's individual needs, and this planning for the support should include the families and the child themselves as much as possible. As I've already mentioned, needs can change and support can change too. So sometimes children will need different support in different subjects or at different times in their lives. So for example, changing schools or coming back to school after a period of absence. So reviewing support is a key part of the planning process. Some of these supports are things that the school can put in place quickly or easily without needing lots of extra resources, but others might require the school speaking to specialists or arranging for some assessments. Sometimes the smallest changes can make a big difference. So when families ask the school about how they can help and what works, it's always a really good place for everyone to start. And this is just because the school have knowledge of what's worked well for children in the past at school, and then along with this, the child, their parent, carer, or a family support worker's knowledge who works with the family, all of their knowledge can really work together well so that they can find something that helps. And this can get things moving quicker, or it can improve things with little bits of support while they're waiting for input from other services. So, with our focus today being on supporting children with long-term health conditions, we'd like to share some key facts around supporting pupils with healthcare needs. So yeah, the head teacher, along with the local authority and NHS board, is responsible for getting healthcare support in place. And the day-to-day support tends to fall under the school support staff, but also sometimes healthcare staff. The school should have a policy in place for meeting the healthcare needs of their pupils, which they should share with families when their child starts that nursery or school. And if the child's healthcare needs affect their ability to attend school or nursery or to learn, they should have a healthcare plan drawn up, and that'll be done in partnership with the healthcare staff. A healthcare professional should decide whether a healthcare plan is needed. So that would be like a paediatrician, the local health team, or the children's nurse. So our webpage that we've created is called Supporting Pupils in Healthcare Needs. You can find that again in the parent carer section of our website, and that covers what should be in a healthcare plan. So you're welcome to look through that at your own time, and we plan on sharing certain pages that should link in well with this webinar in an email afterwards as well with you all. And yeah, so, but just for example of some things that could be included in a healthcare plan, could be the child's healthcare needs and their impact, the type or dosage of any medication the child might take, and storage information for that medication, their learning support needs that are resulting from their condition, and who's going to be providing the child support, and also emergency procedures and contacts. So families can speak to their child's healthcare team or the school if they feel that they should have a plan in place, a healthcare plan. And the local authority has a duty to make sure as well that the child can continue learning while they're absent. So the education that they receive while they're absent should support a broad and flexible curriculum that reflects their existing learning. And it should suit the child's state of health and where they are. So for example, that might be at hospital or at home. So if it's known that a pupil is likely to be absent for 5 days or more, and if health allows, then education should be put in place immediately. And if it's not clear how long they're going to be off, then education should really just start as soon as possible. And it should be in place, education should also be in place after 15 days off in a row, or after 20 days of frequent absences as well. So again, we've got a webpage that links in with this called Missing School Due to Physical Health Needs in the Parent Care section that you're welcome to check out. Okay, and just lastly, I'm going to go over GIRFIC, which a lot of you have probably already heard of. So yeah, we just wanted to give it a quick mention. So it's Getting It Right for Every Child, or GIRFIC, is a framework that sets out how schools can support children's wellbeing. So GIRFIC uses the Shinari indicators to help us think about children's wellbeing. And yeah, hopefully you're familiar with them already, but the Shinari indicators are safe, healthy, achieving, nurtured, active, respected, responsible, and included. So GIRFIC and the Shinari indicators can be a really helpful tool when thinking about how to support a child in school and to check whether the support's working for them. So for example, do they have everything they need to feel included at school? What opportunities do they have to achieve? Does the child feel safe when they're at school? And yeah, that's everything that I've got to say about GIRFIC. So thanks for listening to me. I'm now going to pass over to the Teapot Trust to talk more specifically about long-term health conditions and the work that they do.
Hello, thank you so much for that, Beth and Lisa. Really interesting to have the kind of overview of the legal frameworks that are there. Amber and I are going to be thinking more about what that looks like both day to day for children and young people living with a chronic illness, and also crucially about what that bigger picture is for someone's journey across their time in education, considering also the other things that are going on in their life. So I'm just going to start with a quick overview of Teapot Trust, in case that's helpful for folk. So as I said earlier, Teapot Trust works with children, young people and families living with long-term health conditions, supporting the mental health needs that come with living with long-term physical health conditions. So often we're working with folk who are having a tricky time because of difficult experiences that they've maybe had in a hospital setting, or anxieties around being different, anxieties around the future, a whole range of different topics, and we do that primarily through art therapy. So I work with a brilliant team of art therapists who are some of them are based in hospitals, in clinics, in hospital schools, in mainstream schools, in community, working online, and in all those spaces supporting children and young people with long-term health conditions. And complementing our art therapy projects is our Young Voices project, which Amber talked a little bit about earlier. Young Voices is our youth work and participation project, which is to be sure that in all the work that we're doing and when we're doing things like this, what we are saying and doing is what actually matters to folk with lived experience of chronic conditions. And that is how the project we're going to be talking about today came about. So today we're going to talk a bit about the Growing Up with Chronic Illness project. And this came about as a result of children and young people of all ages talking about a common difficult experience they had of feeling like they were this whole person with so much going on in their life and so much going on in all these different areas of their life, and they would be, say, walking into a clinic room in hospital and feeling like say the doctor there only wanted to know about this one slice of their life, or perhaps they were in a meeting thinking about school and it felt like only this one slice of them was allowed to be in that space, and that actually to be having to talk to so many different professionals and in so many different spaces and feeling like you can only bring certain slices of yourself to those spaces is a really difficult thing. And those slices kind of felt even more sliced up for folk because there was also a sense sometimes of only the age that they were at that point being the thing that people were looking at, and forgetting that actually, yes, they're that 12-year-old sat in the clinic room, but if they've had a long-term condition since they're 6, then they have 6 years worth of experience that they're bringing at that point. So that was kind of the context behind this project, and we came into this project with these aims that you can see here. So first of all, to give a space for folk to explore and connect over having had these huge full lives worth of experiences, and being able to connect the dots between those in a safe space, being able to, through a series of creative workshops like the one you can see a picture of on the slide, being able to kind of find what were those common experiences between folk, and to create some kind of a resource that tells that story and that can go on to inform other work. So can be a resource there for folks like yourself who work with children and young people, to give an insight into those other areas of their life and the other kind of full picture bits of their life. So yeah, it was a really brilliant project. And so much came up in it, and just want to acknowledge and thank, as Amber shared, Amber was part of this project and is here, but also just want to thank all the other folk who were involved in this project and shared their time and their experiences to create this brilliant resource. And you can kind of see it there on the picture, but we had this kind of timeline emerge, and that is what we're going to give you a bit of a snippet of now. So we have this full resource that I'd really encourage you to have a look at, and it kind of gives you a timeline of some of those experiences, those shared experiences rather than any one individual's experience, from, I think it starts at 4 or 5 and goes all the way up to early 20s. And of course, we know you all will work with probably just certain age groups, or maybe just primary school or just secondary school or whatever it might be. And so we thought we'd look at 12 and 13 as that kind of transition age, but really encourage you to look at the full resource and zoom in on, who is it that I work with, and really zoom in on that, but then also remembering, okay, this person I'm working with at this age will have been these ages before and will go on to be these ages after. So yeah, I don't know, Amber, if you want to start us off with kind of an overview of what we got going on the age 12 part of this timeline.
So I think the biggest thing from here is the transition side of things. Like moving to a new school is a big enough challenge as it is for young people, let alone when you think about young people who have long-term health conditions, which also often co-occur with neurodivergencies. So on here, you've got things like moving to high school being such a big transition, not having the words to explain a condition to lots of new people. So you're going from spending time in one classroom, often with one teacher, and then like one set of support staff, to spending lots of time in lots of different classrooms often, and having to kind of take a bit more ownership over what your support needs are and explaining that. And the lack of language comes through really clearly in a lot of the work we do, in that finding the words to explain in a way that feels comfortable what you need from a space to get you to be your best self is a really powerful part of that. But it's also really tricky to figure out. I think at the age of 23, I've just about figured out how to answer, please tell me about your access needs, without overthinking it too much. But at 12 or 13, I think I would have needed quite a bit of support to find that language. And then on the other side, you've also got feeling like the only one with a health condition. And statistically, we know that's not true. But for young people within schools, it can often feel like that they are the one person in their class that has the kind of extra thing. And that can sometimes be quite alienating from a friendship point of view. But alongside that, they also have kind of the medical sphere of their life, where they might start to feel a bit too old to be in the kind of children's ward spaces. And the services they access might change as they've kind of moved into a new age bracket. And they might be starting to take more kind of agency and responsibility for their own kind of physio and treatment, and kind of you couple those responsibilities with your kind of school responsibilities and just the general thing that comes along with being a 12-year-old, and suddenly the young person you've got in front of you is juggling so many more plates than just being like sat in front of you in their classroom. And often to get them there is a huge kind of undertaking that nobody sees. It's like the tip of the iceberg. Yes, I'm sat in front of you, but to be able to be sat in front of you, there's so many kind of parts that have to slot into place to make it happen.
Completely. And I think it's something that came through really strongly in the workshops and in the sessions and in the conversations, was that sense of just like not feeling like you had a space that you really fitted into. If you were, if you'd got comfortable at your primary school and then you were moving to a high school and it was all new, and same with if you're at your children's hospital, if you're starting to kind of notice that actually you are one of the older ones in the waiting room, and the toys on the floor no longer feel that appealing, can be quite unsettling. I think it's also worth mentioning that for a lot of folk, actually, even at 12 or 13, they maybe don't have their diagnosis yet. They might have been living with years with a long-term health condition, and for years been undergoing investigations and having periods of being more ill and less ill, and still not have that diagnosis, and may have had already some pretty difficult experiences in a hospital environment, both for themselves and on being on a children's ward and being around other children and young people who are not very well. And this kind of continues as we come into age 13. That transition and that already accumulation of experiences for 12 and 13-year-olds I think we will all know 12 and 13-year-olds and know that when you're just starting high school, the worst thing that you could possibly feel is different to other people, and that is something that children and young people with chronic conditions can often feel really acutely. I think worries that kind of often come back to that feeling of being different. So for example, I think one person as part of the project shared that yes, school had said, okay, you find it hard walking with your heavy bag, because again, that's a difference. Primary school, it's okay. you can just get your bag into the classroom and then you're sat down. You don't have to be carrying that heavy bag around all day. Maybe at high school, you do have to carry that bag around. And for this young person, the suggestion was, oh, don't worry, you'll have someone with you and they can carry your bag around with you between lessons. And, that was a a nightmare scenario, because they don't want an adult attached to them between lessons. They want to be able to chat with friends like everyone else is doing. But at the same time, if they don't have that, then how are they supposed to carry this bag between lessons without being in a lot of pain? And in that case, the kind of subtler support there was an exception was made, and they were allowed to leave their books for different classes in those classrooms, so that they had a much lighter bag. And so I think, there's sometimes the gap between what for adults might seem like an obvious and good solution, but it might not feel like that for a 12 or 13-year-old who you're kind of seeing here is really feeling that feeling of different and not wanting to be different. And I think that comes through again in that the quote that's on here about going to the student support centre and how that was kind of a mixed experience. And on the one hand, it was a kind of thing of, oh gosh, my friends aren't going to this and I'm feeling quite different. But then on the other hand, going to this space and finding that there were other people with similar experiences, and actually it was a space where you didn't have to hide who you were.
Yeah, and I think another big one is that comes through quite a lot is that because the curriculum doesn't reflect disability very well, these young people, through no fault of their own, often with very, very fixed ideas about what disability is and what disability is like. And that can sometimes mean that they have very kind of medicalized views about themselves, and whether that's they think that their body is wrong or the way they think is wrong, when actually it is just different. And their peers around them also then don't have the education to say, yep, they're just doing things in a slightly different way, and existing in a disabled body isn't the end of the world and they can live happy, fulfilled lives. But because nobody's telling them that that's a thing or showing them that that's how the world can be, the internalized ableism can be really huge. And also the ableism from peers, even by accident. Like, I was on a part-time timetable when I was at school from the age of about 14, and frequently I would get, oh, you're so lucky, you just get to go home and watch TV all day, when actually I would do anything to be in school full time, and I was going home and I was resting because I was completely exhausted and my symptoms were really tricky to manage. And yeah, it came from a good place, like they were just kind of throwing a joke about, but actually that was really damaging. And then I felt like I had to explain myself, and then sometimes I'd share more medical stuff than I wanted to kind of contextualize the support I had, and that can be tricky as well.
Yeah, there's so much, and I actually think we could keep talking about this, just these 2 slides of 12 and 13 forever. And this is why please do have a look at the real thing. But I don't want us to run out of time to talk about Amber's brilliant research. So Amber, yeah, over to you.
So I've brought some of my research from my undergraduate degree here because it was about the experiences of young people with energy limiting chronic illnesses in mainstream secondary schools. And energy limiting chronic illnesses like ME are some of the most common long-term health conditions for young people of secondary school age. So there was a set of questionnaires that I filled in. I think there were about 30 of them that collected the experiences of all different kind of supports that work, supports that didn't work, what was tricky, what worked well. And in the kind of challenges which were identified was attendance and not being in school really started to matter. When at primary school, it was kind of not the end of the world if you missed a day here or there, or you had like a prolonged absence. At secondary school, that really shifted because the work was always cumulative and building on each other. So you needed that foundation. Often met with staff lack of understanding, where people didn't really understand what an energy limiting condition meant for a young person sat in front of them. But on the flip side to that, there were also lots of examples of brilliant staff who understood what it meant and did learning to kind of make it as good as it possibly could be. And then the vast curriculum you get at secondary age was another challenge. Not only are you kind of managing your core English, maths and science, you've got all of the other subjects that come with that. And managing that was what one of the young people described as an insurmountable challenge. And then maintaining friendships was huge. If you're not in the classroom, able to kind of spend as much time with your peers as you wanted to. then you're probably going to end up feeling quite socially isolated. Quite a lot of the young people said it was the only time they saw their friends, because by the time they'd finished a school day, they were completely exhausted and not able to kind of do the social commitments outside of that. There we go. So I could give you lots and lots of more examples of where things have gone wrong, but that's actually not that useful, because, well, what is the useful thing is knowing kind of what you can do to help. And listening is the biggest one. Staff taking the time to understand and listen to experiences and access needs as individuals. It kind of creates that trust and making people feel more confident about asking for help. Doing that as a disabled young person in school when you're small really sets you up for a life of having to continually advocate for yourself. And I don't think I would be as confident now in knowing what I need if I didn't have staff that met me where I was at the time to help me kind of have the confidence to identify and say that, and be told that it was okay to say, actually, I think it would be better if you could support me in this way, or actually, I don't need you to do that today, but that doesn't mean I don't need it on the other days of the week. Another big one is acknowledging the social opportunities and them being just as important as academic ones, even when kind of grade boundaries and kind of limitations from other systems don't necessarily prioritize it. At one point, I was literally going into school for 15 minutes at break time just to see my friends. And yes, the school staff probably did want me in for 15 minutes of maths, but 15 minutes with my friends did more for my mental health than 15 minutes of algebra ever would. And I think that's really important to emphasize. Again, we're like much of the kind of legislation that was spoken about. It needs to be person-centered and responding to individual needs. And there's also some quick wins. Things like somewhere to store heavy books, printing out materials, PowerPoints to reduce note-taking, helping to prioritize tasks. So say a young person has missed a week and you've got lots of lessons to catch up on. Maybe you pick 2 of the tasks out of the 4 and really let them prioritize their energy on the most important bits. And then something at my school that was a thing that might continue across lots of other schools was not being able to be inside during break and lunch times. But that meant managing kind of the weather, and that impacts energy limiting chronic illness loads. So having like a space to be inside is fab. And also having non kind of pressured check-ins and a key person to kind of coordinate support or changes is really important.
Thank you, Amber, for sharing the brilliant research that you have been doing. Yeah, it's something that came across so strongly in the project was everyone had education staff who had made the difference for them and made school a place that did set them up for life. And so we just wanted to share some of the quotes that came up around that. So you can see someone here shared that having someone at school who understands and looks out for us makes life so much easier for us. We don't need you to fix anything. Being open to understanding the impact of our chronic conditions and working with us to make learning accessible to us makes the world of difference. So taking this forward, because yes, we want to end on positive notes. We hope that you have kind of taken in some of what it is to be a child or a young person living with a chronic condition at school. And in terms of taking this forward, we would really encourage you, can you have a think about what one small thing you could do for a young person you work with could be that would make their day a little bit easier, or show them that you can see that there's a lot of stuff going on around the edge for them? Can you have a think about how you don't need to fix everything, and sometimes just being a listening ear is more helpful? And also, don't be scared to get it wrong. We have all had folk who have not got it quite right, but in trying, showing that they want to get it right. And in those cases, just as Amber was saying before, actually it's a brilliant thing for someone to kind of correct you and be able to get it right from there. So yeah, that's all from me and Amber just now, and we will pass it back to Beth and Lisa from.
Thank you so much, Ali and Amber. That was fantastic. So insightful in terms of the experiences that you shared, Amber, but the project itself. Lisa and I have both read the resource, and it's so fantastic and really just As with so much of the work that we do, I think when you're hearing it directly from children and young people, it just makes the world of difference, and they speak so eloquently through the whole, from all age groups about what they felt. And if you haven't lived with a chronic illness, hearing that experience directly is really great. So thank you for sharing all of that and talking about the work that you do. Before we move on to the Q&A part of this evening, we just wanted to share some of the sort of overarching sort of top tips, go-to strategies that we would suggest from Enquire's perspective. So if you were to call the helpline, or if you were to look on our website for advice about what to do, these are the sorts of things that come up all the time. Broadly applicable to lots of different situations, but certainly applicable to working with children who have long-term health conditions or chronic illnesses. The first thing we've kind of mentioned throughout, and certainly Ali and Amber mentioned it too, listening is huge, and listening to everybody. So I think it's really important always, of course, that we listen to the child, but I think particularly for a young person that's living with a long-term health condition, they're the ones that are living with it, and they've got the experience of it. They know how it impacts them, and they have an insight that we should make the most of. They know what they need and what's going to work for them. Similarly, listening to parents and carers whenever you get the opportunity can be really valuable, because they're seeing that the child in a different situation. They're seeing them at home. They're probably going to a lot of those health appointments with them. It might be that the child likes their parent or carer to advocate for them, especially when they're younger. Also then talking to your other colleagues and other professionals that might be involved in that young person's life. As Amber was saying, some teachers are fantastic, and sometimes children have a particular relationship with one member of staff or another, and making the most of that relationship in order to provide the right support can be really valuable. If they get on with a particular support assistant, or they really love modern studies, so they get on really well with their modern studies teacher, why not engage with them and hear from them what might be helpful for that young person. Of course, with somebody with a long-term condition, it might also be that there's lots of health professionals that would be worthwhile hearing from when you're trying to plan support. Like we've kind of said, it's nobody's responsibility, and certainly within education, there's no expectation that education staff will be experts in every single condition or health condition that they might come across with. But the way to manage that is to talk to the people that are experts in those things. So if there are opportunities to meet directly with those healthcare professionals, or even if not, to hear from the family or from healthcare reports, or like we were talking about healthcare plans and stuff like that, getting all that expertise from everybody into one place is going to make a better strategy than trying to come up with it yourself. With that in mind, another thing that can be really helpful is asking for a meeting and taking some time to prepare for that. Especially with young people that maybe have lots of professionals in their life, having a space where you can all discuss things together can be really valuable. I know that teachers and school staff have a lot on their plate, and timetables are very busy. Arguably having a singular meeting point and a 30 minutes, this is the time we're gonna sort this out and we're gonna talk about it together, can be really valuable. And it means that it's not playing on your mind all day, every day, and you're trying to figure it out between things. Setting aside that time can be really helpful. Similarly, written plans is really valuable, especially with someone that's got a long-term chronic condition, knowing what that looks like. And as Amber said, those needs can change. So if that condition that they have is one that maybe comes and goes, or has flare-ups, or does things like that where it might change, having a strategy in place and having that written down can be really valuable, because then it means everybody involved will know where to find the information that they need to give that young person the best support. And then, there's loads of further advice and support that can be helpful. Assessing children's needs can be valuable, as we mentioned earlier. Although you don't need a diagnosis, having that understanding can be helpful. And with children who have a long-term condition, pursuing or supporting the family while they pursue those assessments can also be really worthwhile as well. Also, as school staff, as Lisa mentioned, the responsibility for providing support is actually with the local authority. And what that means from a professional's point of view is that if you aren't sure what to do, and if the school that you're working in isn't sure what to do, you have the right to go higher up and ask the local authority for their support and their guidance. If you're working with a young person that is receiving support from lots of different places, it might be that a local authority member of staff would be able to support that process We've not got time to get into coordinated support plans, but certainly something that you might want to look into in terms of getting that right plan in place if there are lots of people involved and the local authority can support with that. And the last thing that we've mentioned there, although there are lots of things on our website to do with support planning steps you can take, is mediation. And that's just an example of one of the things that you can use if you need to, if you're trying to do everything right, if you've tried XYZ and it's not worked and you are feeling a bit stuck. There are other processes and procedures that are in place to help everybody figure out what's best to do next. So it's time for a break. We are 45 minutes in, so I think we've got time for a 10-minute break. What we're going to do after that is the recording will finish here